A very warm welcome to all of you. Welcome to this very special show with me, Oinitam. Cancer is still one of the most dreaded diseases and it is painful too. It causes not just physical pain, but at times patient and family goes into depression. It causes a lot of mental trauma. Cancer treatment also leads to a lot of financial stress for many. Today, we are going to talk about palliative care in treating cancer patients. We are going to talk about how proper palliative care can ease not just the physical pain of the patient, but can also, to a great extent, ease the mental stress and mental pain. And to talk about this, I have with me today Dr. Gayatri Palath. She is the professor and head of Department of Pain and Palliative Medicine at MNJ Institute of Oncology and Regional Cancer Center, Hyderabad. And also joining me today on this show is Dr. Tanma Das Mahanta. She is the head of Department of Palliative Medicine at Dibrugarh Cancer Center, Assam Cancer Care Foundation. Now, Assam Cancer Care Foundation is a collaboration between Tata Trust and the government of Assam in Medical College and Hospital, Dibrugarh. Welcome, doctors, to this very special show, and thank you for being here with me today. So,
thank you,
Dr. Gayatri, would like to go to you first. Would really want to understand from you what is palliative care, what does it mean, and how is it, and what is the kind of relevance as far as palliative care is concerned in today's world?
Thank you very much. Thank you very much for the introduction. So just now you mentioned about the impact of having a cancer on a person's life, how it affects the patient and it affects the family and it affects the entire community. And if you look at the statistics today, it's a growing number of cancer. And there's a real concern that how the cancer is exponentially growing. And they say around, it's expected that in next another 10 years, it's going to be real increase in number of cancer. And the worrying part is that even today, in India at least, most patients, by the time they come to seek any health advice, they're diagnosed late. And once they're diagnosed late, the cure is not possible. Palliative care, it's a branch of modern medicine. And this is a medicine which deals with taking care of the patients when the cure is not possible. While the cancer treatment is happening, patient undergoes tremendous amount of suffering. And this is a specialty which looks after taking care of the suffering of these patients and their families.
Right. Okay, we'll talk more about how all of these happens, what is the kind of medicine, the costs involved. We would actually like to hear about all of these from both of you. But now moving on to you, Dr. Tanma, what are your views about palliative care? But, my question is specific to cases, cancer patients in Assam. And also, of course, like Dr. Gayatri just mentioned, the number of cases of cancer is rising across India, but Assam, of course, the data there is quite significant. In fact, since 2018, though the data shows that it did dip, I believe in 2019, as far as the few cases, new cases, there might have been a slight difference there. But since 2018, we see a huge rise as far as the number of cancer cases in Assam is concerned. So definitely the demand for palliative care, be it the proper caregivers, the right kind of medicine, a lot of things are involved in this whole palliative care. So what are your views specifically about Assam?
Yes, thank you, Anitam. First of all, as you know, this palliative care is a new concept comparatively to this part of the India. And it started well with a NGO, Guwahati Pain and Palliative Care Society, way back in 1999. And since then, I have seen that, the number of caregivers that actually should have been there in Assam, especially in the field of palliative care, is not adequate. looking into the increasing number of cancer patients here.
Yes.
And as Dr. Gayatri has rightly pointed out, most of them are diagnosed in the third or the fourth stage, and they're coming to our hospitals. As you know, Assam Cancer Care Foundation
Yeah.
has already established two L2 level hospitals, one in
Right.
Dibrugarh and Barpeta,
Yes.
and other L3, 5 in numbers in Lakhimpur, Kokrajhar, Darang, Tezpur, and Jorhat. But thing is that I think infrastructure-wise, we are really growing in a very great speed
Right.
for these cancer patients. But thing is that about manpower, when we are we have seen that we are focusing more on the curative aspects.
Right.
Actually thing is that most of the patients that are coming to us are not in the curative stage at all.
Okay.
They're all coming to us in the late stages,
Yeah.
where palliative care is only help that they need. And we are not, I think PC is not being delivered in a systematic way right now in Assam.
Okay.
And we really need a lot of centers coming up
Yeah.
and doing the right thing in a proper model kind of thing.
Okay, so we have a long way to go as far as Assam is concerned. Assam and palliative care is concerned, but we'll of course get back to you, Dr. Tanma, and know more about how Assam is doing, how Dibrugarh Medical College, the facility there about cancer care, how things are happening there. But moving to you, Dr. Gayatri, one more time, how best do you think can palliative care be delivered?
A very important question. I would say in a simple statement,
Yeah.
wherever the patient needs it.
Okay.
So when the patient is diagnosed with cancer, the patient moves between different setup from home to a medium level hospital to a tertiary cancer hospital and back to again some local nursing home and home. So patient is moving transiting between different setup and in the home. So wherever they are moving, they should get it because they have pain, they have suffering,
Right.
and it cannot be that said that they can only get it in Dibrugarh Medical College. And what about the patients who are there in the home who can't come to the hospital?
Right.
So,
Yes.
ideally speaking, there should be hospital-based palliative care, there should be home-based palliative care, and there's another thing we call it as hospice.
Yes.
Hospice is a facility where we admit the patient and we look after terminally ill patients. So we also need a hospice facility, which is somewhere between home and the hospital, where you have all the setup like a home, but you get the best of medical care. So you need a hospital-based palliative care, home-based care, and hospice facility.
Yes. So these are basically the three types of necessities as far as the palliative care is concerned. Now, Dr. Gayatri, another question to you. I mean, here I have you who are based out of Hyderabad and doing a practice there. And on the other hand, I have Dr. Tanma Mahanta, who is based out of Dibrugarh in Assam. So I'm sure both of you must be handling different sets of not the disease, but different sets of people altogether coming from different backgrounds, different societies, different economic and financial backgrounds as well. So first, Dr. Gayatri, to you, a little bit about your experiences. You know, what kind of challenges do cancer patients face when they want to go for palliative care?
I work in a tertiary cancer hospital, which is a government cancer hospital. So majority of patients I deal with are from very poor socioeconomic
Yeah.
strata. And even the middle class, by the time they finish cancer treatment, they almost become poor because
Right.
most of the time it's out of pocket expenditure. So, and they become very poor. That's the social element of it. But to provide palliative care to such a huge number of patients, one is the number of patients we're talking about. It's a huge number. So in my hospital, in my department of palliative medicine, I see around 80, average 80 patients every day.
Right.
So that's
Yeah.
the number I'm talking about.
Yes.
So the one is the number, one second is the geographical distribution because they all go back to their homes and they're widely distributed. So if you really want to have access to good palliative care, it should be decentralized. It should be closer to their home. So that's another challenge. Third biggest challenge, I would say, the lack of awareness. Okay, lack of awareness in the community, but more important is lack of awareness among health professionals. most of our doctors and nurses are not trained in palliative care. So they don't know much about palliative care, so they don't know when to refer, why to refer.
Yeah.
And the lack of training, which becomes a big challenge. And the fourth most important part is availability of important medications which we need in palliative care. Remember that patients with cancer, they have excruciating pain, which
Yes.
normally we don't experience in our day-to-day life. And that kind of pain can be dealt only with very special medications. We call it as opioid medications like morphine. And that should be made available to these patients closest to their home. And that is not available today in most of the places in India. So these are major challenges which we face.
Right. Dr. Tanma, I will come back to you, but let's quickly take a break here. On the other side, I'm going to talk to Dr. Tanma about the situation here in Assam. Welcome back. We are in conversation with two leading oncologists. In fact, they specialize in the palliative care space as far as cancer treatment is concerned. And now I would like to go back to Dr. Tanma Das Mahanta. She's joining from Dibrugarh. Dr. Tanma, talking about Assam, we just heard Dr. Gayatri talking about the challenges overall. I'm sure the Assam story might not be any better as far as palliative care is concerned. How prepared are we as a state? What about the government hospitals, the private hospitals? What about the status in these spaces as far as palliative care is concerned?
To start with, let me tell a story in Dibrugarh. Like in 2018 November, we with just one nurse and myself, we established the first palliative care center in what happens to be the first medical college in Assam. So, and we made morphine available at that time.
Yeah.
And so you see, it is as late as 2018, and now it has been 5 years. And this is the first unit. We made oral morphine available, and until then, morphine was not available in whole of Upper Assam. And all the neighboring states, now we are catering to all the neighboring states as well, like Arunachal and all. They come and take morphine from us. So just as ma'am has said that we need to decentralize. I think morphine should be it's a pain relief is a right of the patient. So that
Yes.
particular medicine is like life to them. So it should be made available and proper under the since it's a narcotic, and all the rules and regulations need to be followed along with it. So proper trained personnel are very important in
Yeah.
dispensing narcotics, and for that I would really like to request the government of Assam to put some focus into this matter and not just concentrate on cure part. And because the need of the hour is palliative, because of the huge number of patients who are coming to us at the late stages. And in Assam as a whole, I mean, there are pockets where everything is available.
Right.
Palliative care facilities are available, but these are pockets. And so people sometimes have to travel long distances to get the bare necessity, minimal medications that are required for
Yes.
pain relief or other symptom relief. They have to travel long distances. And I'm sure now that the hospitals are coming up, and side by side the palliative concept of having a hospice along with a home care service for each center, if it comes up, it will be of great help to the people of Assam.
Absolutely. And we hope all of these things happen really fast. Dr. Gayatri, what about the expenses? Because I'm sure, like we have been mentioning this over and over again, and everybody knows cancer treatment is expensive, no matter which stage the patient is in. And of course, like you mentioned, both of you have mentioned excruciating pain. Now, many people might want to go for palliative care. What about the cost that's involved here? Is it really expensive?
Actually, that's the beauty of it. Like I would say, I don't know whether to say beauty, the fact that it's a very low cost proposition. such we can, with small amount of money, we can reach out to so many patients. Here, we are not talking about very expensive medications. A morphine tablet costs 1 rupee,
Okay.
one tablet.
Okay.
It's as cheap as that. And we don't use very high-end machines for treatment. It's all about care. um, Medications are there, medicines are, it costs money, and what cost is human resource.
Oh, all
And
right.
whenever we make a budget, the problem is that whenever we say we need more human resource, there's a reluctance from the donors as well as from administration. But what we need actually is human resource. It's like in ICU care for doctor nurse patient ratio should be quite high so that the patient gets most optimal care. So
Right.
human resource is the expenses which we have to invest on if you want to really provide a good quality palliative care. So medicines, one part of it, and the human resource, and of course the infrastructure, which is again not very fancy. We
Right.
talk about very simple infrastructure where the patient can be comfortably placed. But what we need is human resource.
Okay. Quickly, would like to know from both of you about the awareness level as far as palliative care is concerned.
So maybe
Yeah.
I would say in India of late, of last 1 decade, we have made a lot of progress in terms of creating awareness. People are still getting to know the fact that we are today speaking in your channel. That itself is like kind of it's just that people are getting more aware. But there are some pockets where nothing is happening, nothing much is happening. So we still have a
Yes.
long way to go. And awareness, I would say, in the community, awareness among health professionals, both two-pronged approach. And media can really play a very important role in doing that, I would say.
Right.
Thank you.
Yeah. Dr.
And
Tanma. Yeah.
yes, in Assam also it's the same thing. Like until a few years ago, nobody used to know the name palliative. Actually, when I came to Assam Medical College, even my colleagues, I mean the doctors, nurses, nobody heard the word palliative until we started working and started showing results that they had confidence, started having confidence in us, and now all patients in AMCs are being referred to us. So that is a level of awareness as we talk about. Like we need to have more awareness programs because as we go into the interiors, they're still not aware about their right. They don't know where opioids are available. They don't know where to go when they have severe pain with cancer. We still have a long way to go. I'm sure Dr. Gayatri Pallad, who is working in or has worked in Kerala and Telangana,
Yeah.
there, even the literacy rate is quite high. People are quite aware. But in Assam, I see a difference. Like many are not even aware about what services they should be getting,
Yes.
where they should get the pain relief, where to go.
Yeah.
That's just
And also, what is the status? I'm referring to Assam one more time. What is the status of trained manpower for palliative care?
as of now, since I have been in the palliative care scenario for the
Yeah.
last 23 years in Assam, and I have seen just a handful, who are
Okay.
actually trained in palliative care. Nowadays, there are many courses like 2-day course, 2-day, training programs and all, and that is not adequate enough to give palliative care. So many would say I'm trained in palliative care, but they are not so. Actually, minimum, I think at least 1.5 months of training. Or very recently, MD courses have started
Okay.
since 2014.
Right.
So we have very handful of MD students coming up for this palliative thing, and slowly and steadily we will increase in numbers. I mean, those numbers will increase, but until then, I mean, well, World Health Assembly, 67th World Assembly, has taken note of this dearth of manpower, and they have advocated, how to help the policies. I mean, they have directed the member states,
Right.
to strengthen the, palliative care policies, and also to strengthen the, manpower, how to train them and give the start and give services
Okay.
to all the lacking, lacuna in this area.
All right. And of course, finally, the Northeast Oncology Summit is being held. I believe it's being organized by ACCF, and it's happening on Jan 27th and 28th. So, Dr. Tanma and Dr. Palat, I'm sure both of you would be available there. And what more can we expect? If you can shortly, if you can give us a little brief about that, about the summit.
Actually, we are having national faculty coming.
Okay.
Dr. Karti Palat is one of them for us in palliative.
Yeah.
And other medical oncology side and surgical and radiation oncology people will be coming from all over the country for this summit. And we hope to see a very interesting and update on everything and enrich from this conference. And also it is a means to, showcase our palliative, so
Right.
that how much we are doing, and we want to showcase that also, because
Yes.
this is one segment in cancer care which is lagging behind, and we would
Right.
like to bring forward what we are doing. We really want to showcase so that, everybody takes note of it and really
Yeah.
see that how helpful it is to the society.
Right. Well, thank you so much. And I'm sure, maybe hopefully this short conversation that we had about palliative care will go a long way in helping many of the patients out there. But I'm sure, like both the doctors mentioned, lot needs to be done. But I'm definitely sure under the leadership of our present Chief Minister, Dr. Himanta Biswa Sharma, Assam government definitely is already doing a lot. We already have the Assam Cancer Care Foundation with the Tata Trust. I'm sure a lot more will be done in the coming days to ease the pain of all those cancer patients out there. Thank you both the doctors for being with me on the panel today, and thank you viewers for watching. Keep watching Northeast Live for all the news and updates. Thank you once again. Goodbye.